This is Rebecca Brown. She is harassed daily by her husband and struggles with the stress that her life imposes on her. Following suit of her friends, she begins to go crazy. Her husband finds his wife becoming harder to deal with and soon begins to look for a way to get rid of her. Hysteria was a common ailment in women and Rebecca's situation in the 19th century. Many women were admitted to hospitals by their husbands so that they would no longer have to deal with their wives.
This is Betty, the Browns family maid. Betty's son has noticed that she has been sick for a long time, but has never been able to pay for proper treatment of his mother's illness because of his low income. This was a common occurrence in poor patients in the 19th century. Eventually, others noticed Betty's condition and she was admitted to a public hospital.
Inside the private hospital, Rebecca is greeted by friendly nurses who seem to care very much about her well-being and happiness. Rebecca meets with her physicians on a daily basis and is very interactive with many other patients. In total, there are 100 patients that have been admitted to the hospital. The basis of treatment in private hospitals revolved around the moral treatment method. This was the most common treatment among private hospitals in the U.S. and involved placing patients in a new environment where they were treated with kindness, patience, guidance, and understanding. It is the kind of treatment that Rebecca receives during her time at the hospital.
Upon Betty's arrival in the public hospital, she is taken to her room and left alone while her son meets with physicians in order to discuss Betty's treatment. Betty is given a strict schedule that she must compile to every day. This schedule does not include leisure time with other patients or any free time. It is spent in her room alone. Physicians meet with Betty once a week in order to check up on her and evaluate her progress. In total, there are currently 300 patients in the hospital, which leads to a lack of direct contact with physicians and patients. Because of the large population of patients, moral treatment isn't possible. The rest cure is invented, in which the patients were not involved in physical or social activity for a prescribed amount of time.
There is a large difference between the public and private mental hospitals and the way insane patients were treated in the U.S. throughout the 19th century. While private hospitals mainly catered to wealthy patients, public institutions were left with lower-class patients who were not able to pay for treatment. This means that public hospitals were not able to treat people efficiently with the most effective treatments.
Patients were treated differently depending on their social class, wealth, and gender, as well as the severity of their illness. Curing mental illness depended on the removal of the patient from their life outside of mental institutions. Peace, discipline, and a strict schedule was necessary for development and recovery.
Physicians realized that in order for moral treatment to be effective, the size of the institution had to be kept small. They initially wanted a socially mixed population, but faced financial problems and the ability to pay became the primary factor in a patient's admission. Many people could not pay, and private hospitals came to serve only wealthy clientele.
This started the establishment of larger public institutions, and moral treatment became ineffective because of the sheer volume of patients. Psychiatrists moved away from the care of the institutionalized insane to establish psychiatric wards and general hospitals and turned to more treatable conditions.
Created using Powtoon.